Many of us were very surprised when we had a measles outbreak in Clark County early this year, which eventually spread into other areas like King County. In fact, Washington State has seen about 8% of the measles case in the U.S. this year. And just last week, another case was reported from a nurse at Children's Hospital in Seattle. Weren't measles one of the success stories of modern medicine? A childhood disease that could turn deadly but was eradicated by vaccines in the 60s? Evidently not. Our guest today is here to tell us the barriers to eradicating measles and other infectious diseases, as well as her experience in the field, finding what the health response should be to these outbreaks. Patsy Stinchfield is a practicing infectious disease and immunology nurse practitioner with over 30 years of experience in children's hospitals. Ms. Stinchfield obtained her undergraduate degree with honors from Minnesota State University and earned her Master of Science degree in nursing at the University of Utah. In 2004, she was named the first nurse voting member in the United States to the CDC, which is the Center for Disease Control's Advisory Committee on Immunization Practices. She continues to serve as a liaison member representing the National Association of Pediatric Nurse Practitioners. Her honors and awards are numerous, as you can see from the table preview that's on the table. And among them is the CDC's Immunization Champion Award for Minnesota in 2014, and the Pediatric Nurse Practitioner of the Year Distinguished Fellow Award from the National Association of Pediatric Nurse Practitioners in 2012. She flew out here from Minneapolis yesterday to give us this presentation. You may have seen her speak on one of her many network appearances, but she is most proud of her greatest accomplishment, being the mother of 2 fully immunized adult daughters who thought it was cool that mom was quoted on John Oliver's TV show. And maybe her second most proud is the grandchild to be coming soon. Please join us in welcoming Patsy.
Thank you. Thank you so much, Jane and Maureen, for that warm welcome, and thank you for your beautiful Bellingham City Club for inviting me here today. It's really an honor, and when I accepted this award, accepted this invitation to come and speak today, everyone I said, I'm going to Bellingham. They're like, oh, you're so lucky. That is the most beautiful place on the earth. And so I was wisely added some days to my trip here. So I got to poke around yesterday. Poke around, you're going to hear a little Minnesota accent there. And what a beautiful, beautiful city you have. It's really, really an honor to be here. And thank you also to Bill and to Georgia, who joined Jane and I for dinner last night. We had a wonderful dinner, just a tiny bit of politics at our conversation, which was quite enjoyable. So this is my 3rd time to Washington State in 3 years, and partly because I'm a measles geek. I've experienced it way too much in my career at the Children's Hospital in Minnesota, and have learned a lot about the disease, how to treat it, how to prevent it, how to have public policies to work with it. So Washington State, sort of seeing the writing on the wall 3 years ago, invited me to come to the Well Within conference, and I spoke there about how to prevent the spread of measles and what to do when it comes to your neighborhood. So I gave a couple talks there, and then last year spoke at the Washington State Public Health Association, and I just want you to know you have one of the best state public health departments in the country. They're very, very well respected across the United States. Minnesota does too. Sometimes they call us the CDC of the North because we have a fancy lab. But we are, our states are quite similar, and I'll show you that in a minute. So again, thank you so much for the invitation. I will save time in the end for questions, and so we can get into some thoughts that are on your mind related to vaccines, outbreaks, and the like. So measles, here it is, 2019, and we're talking about measles. It feels a little bit surreal. to be talking about measles in this day and age, and it is quite worrisome that we are having to talk about measles. There's a couple of people in here with gray hair that might have had measles themselves, so a picture like that might be a little familiar to you. I'm not going to point out who I'm talking to, but back in the day, I'm of the era, I was born in 1958, I had all three of those diseases. I had mumps, I had measles, I had chickenpox, and many of you did as well. But we were put, oh, thank you, that makes it look really much nicer. We were put in our home with a little warning on our door, and your pals could not come over and play with you. You were in what they called quarantine. And quarantine now in Minnesota is a legal term. We can't use the Q word. Instead, we call it social isolation. Right, so quarantine means that you'd have to have a sheriff at the door with a gun who couldn't let anybody in or out. So we don't use the Q word too often there. But somebody gave this photo to me several years ago after I became quite an advocate in trying to prevent these diseases that I had as a child, and then we were starting to see reemerge, and I did not want anyone else to go through this. And the little girl on the right with the pixie haircut, I had a haircut just like that. So they made this into a card, and they added this little bubble that said, "This is outrageous, something must be done." So it's pretty true. I've sort of lived that as I've gone along. But in all seriousness, the World Health Organization is very concerned about the world in terms of measles right now, and declared just recently one of the top 10 public health threats to the world is vaccine anti-vaxxer misinformation. That if we don't get ahead of the misinformation, we are going to see more and more outbreaks, and we're going to see more and more situations like this where these diseases can and will come back. And we vaccinate because these diseases take people's lives. These diseases take people's hearing or their vision or their ability to have children. We don't vaccinate for any disease that is a ho-hum disease. If we had a vaccine for the common cold, I'm not sure we would use it because most people get a cold and get over it. It's not that life-threatening. Whereas the diseases that we have vaccines for have great potential to cause cancers, to take lives, and so it is really for the public good to prevent these. The other thing you're going to get from this talk today is we are one world. We are a plane ride away from other diseases, from other individuals in towns and in communities that have outbreaks happening right now. And if we care about our children, we have to care about all children. And so you'll see that connection in the world right here back to your beautiful state of Washington. So I'll emphasize that, as well as talking about some specific ethnic groups that have been highly impacted by measles of late. So how are we the same? So here's where I come from. This is Children's Hospitals and Clinics of Minnesota. On the right is St. Paul. My office is at that top corner of the square building. And the left is Children's Minneapolis. We're one company. I drive back and forth on the freeway. We have almost 400 beds. We have about 100,000 outpatient visits and about 250,000 visits per year overall. We have 70 languages that we interpreted, 70 last year. I don't even understand the names of some of these languages. There's like sub languages, and our interpreter services is very busy. And critically, like Seattle, we have an international airport. So that is a really important point when you're looking at global health. So we are alike. Minnesota and Washington have a lot in common. We have many international travelers that use our airports, and just walking through an airport can be what causes exposure and potential outbreak, depending on if the person exposed is immune because we had the disease, or if they're immune because they've had all of their vaccinations. If they didn't, with measles, it is the most contagious infectious disease known to man, and it is only spread human to human, not like flu, that birds get flu and other animals get flu, swine get flu, humans get flu. Only people get flu, only people get measles. And so measles being human to human, we could eradicate it if we put our mind to it. it requires humans vaccinating. Eradication versus elimination, two different words. I wanted to comment on those. Eradication being eliminated and removed from the entire planet. One disease. Anybody know? Very good. Smallpox, one human disease. Measles in the United States was eliminated in 2000, meaning that there was no measles being spread within our own states and our own counties. All of the cases were internationally imported and then spread within our states from there. So we eliminated, which is why in 2000, eliminating measles, and now in 2019, talking about outbreaks across the country is again why the US is worried and the World Health Organization is worried. The other way that we're similar is we are welcoming to immigrants and refugees. We're in the top 8 states of people who accept people from other parts of the world. And refugees and immigrants who come don't always stay put. Sometimes they'll go back to their homeland, visit their relatives, like I did in Ireland. I'm mostly Irish, so I'm going to tell you a few stories today. We go back to our homeland, and then we come back to the United States. And in so doing, depending on where you're going, you may be going back to a country where something like measles is endemic, that's all over the place. So that international travel with refugees and immigrants can also increase our risk for spread. We're also one of 15 states who allow non-medical vaccine exemptions. But I have a cherry on the top at the end of my talk that your state just passed an amazing law, and I'm very proud of you. Yes, you can applaud right now, even not hearing what it is. But maybe you're following this topic. So I'm going to save that to the end because I want to end on a happy note, and that's really happy. We have had the biggest recent year for measles for both of our states was back in 1990. And that neither state is where we need to be in terms of vaccination. We have to have at least 95% of the population vaccinated against measles with an MMR, measles, mumps, rubella vaccine. So you'll look at some states are 78, 90 sounds like a pretty good number. That's pretty high. For measles, because it is so unbelievably contagious, 1 in 10, if there was, say none of us were immune to measles, and someone walked in the room right now with measles, that virus is so tiny and spreads aloft in the air and stays in the air for 2 hours that 90% of us would get infected just by the person coming in and breathing and being speaking in the room. So it's very, very highly contagious. So to reduce the spread, you'd need the vast majority. You'd need 95% of this room vaccinated to prevent that other 5% from getting the spread. That's hard to sustain because every day new babies are born, and so it's a task for public health and private providers. We also have these pockets of very low immunization rates, and we'll talk about some of those groups that have low immunization rates. So today I'm going to cover 4 themes that we're seeing in the U.S. measles outbreaks right now. Number 1, the international travel aspect that I just mentioned. And you can look at the list from 14 through 19, the different very specific groups that have been involved. And one of the biggest outbreaks was in 2014, and it was from some Amish outreach workers who went to the Philippines, and they were not immunized, and they brought back measles to their community, and it spread significantly in Ohio, both inside and outside the Amish community. The Disneyland outbreak, you'll remember from 2015, that was also from the Philippines. Our Minnesota Somali outbreak was direct travel from Somalia, although we never identified case number 1. It was the same strain that is prominent in Somalia. And last year, the Hasidic Jewish community from Israel coming to New York, which is an outbreak that is yet to be under control. That's really worrisome. In fact, if we go 2 more months, because that is continuing now in 2019, if we go 2 more months in New York measles outbreak, the United States will lose our elimination status. So you cannot go more than 12 months without having your measles anywhere in the United States under control, and then you will lose the elimination status. So what does that mean? It means that it's sort of a public health black eye. We may lose some World Health standing, we may lose some funds, but mostly it just says your public health is not in order. And so that's, for people in public health, it's really something that we're trying to prevent. It is not looking good because there were many new cases just last week. And then here in 2019, the Slavic community in Washington, and mostly strains that are prominent in the Ukraine. I'm going to also talk a little bit about that, how the disease enter these tight-knit communities. And then the third thing it does is that it'll enter in a place where there's high vaccine exemptions, whereas people say you can go to school if you're philosophically opposed to vaccines. So if you have a state, and there's only 3 of them, that have medical exemptions only. California recently passed it, West Virginia, and I'll think of the third one in a minute here. You'll see it on a map. But only 3 states have medical exemptions only. And that means that if you want to go to public school or public daycare, you have to be immunized or show a medical reason why you can't be immunized. For example, you have an immune deficiency, so you can't get measles, mumps, rubella because it's a live vaccine, and that would be contraindicated. And so other than that, there's no religious, there's no personal, there's no philosophical. There's only 3 states who have that tight of exemptions. And we'll talk more about exemptions near the end. And then also we're seeing that misinformation increases fear and then decreases the vaccine coverage rate. So all of these elements are things that we're going to have to work on to get our measles outbreaks under control. So here's just a graph that shows you those different outbreaks and the number of cases. So in that Amish community, that was our last big one in 2014. And in 2019 now, we are well, this is a little bit older graph, we are well over that, over 1,100 cases. So we've exceeded that. So let's just look at a world map here for a minute. So this is the number of reported measles cases just in a 6-month period. And look at some of those numbers if you can see them. So Madagascar is its own island and its own public health issues, 81,000 cases. If you look at the Ukraine, which has a connection to your community here, I think that says 60,000. You look down at the Philippines, 23,000. So each of these areas have different reasons for having the outbreak. So in the Ukraine, there was a fear that a young person died right after their MMR vaccine, and it spread through the Ukrainian community that the MMR caused this person's death. And that was false, but it really entrenched. And once you ring that bell of fear, it's hard to unring it. And so people basically just stopped vaccinating. In the Ukraine, they've recently tried to turn that around, so the numbers are not as startling as they were. But throughout Europe, we are seeing a lot of misinformation that's spreading and causing the vaccine rates to go down. There have been 13 deaths of measles in Europe. This is not a developing country. This is Europe. 13 deaths last year from measles. So, and then you look at other places such as Israel, they have other reasons to opt out of vaccines, or you'll look at places like Venezuela that's having a terrible public health infrastructure problem. They have no food, they have very little public health intervention. So there's different reasons why each of these countries, but when you look at the scale, the darkest countries have the lowest immunization rates. And look at the United States. We just moved into that same color as some parts of Africa. And in fact, there are some of the poorest parts of our planet who have higher vaccine rates than Marin County, which is the richest zip code in the United States. You know where that state is. So we have a lot of work to do. So I wanted to zero in a little bit on this map and talk about how, this is sort of an epidemiologist sort of geeking out here. So look at New York and then follow that yellow line. So somebody from New York went all the way over to Israel for a religious trek, for a religious ceremonies and reasons. And then they came back to New York. And then that spread within the Hasidic Jewish community in New York. travel went the other way as well, that there were Israelis who came to New York into this same very low immunized community. But then that other little hook there goes from Israel to the Ukraine. So both from New York and from Israel, people went to a city in the Ukraine that has a traditional Jewish cultural annual religious ceremony that people travel to. And so that intermingling of people unimmunized and underimmunized going to a country with high levels of measles, getting exposed, coming home, and then 2 weeks later developing measles in a community of unimmunized is how these start. And then the Ukrainians, and you can see the big arch over to where you are here in Washington State. Lots of travel between the Ukraine and Washington State in primarily the Russian community. And so they're all connected. They're all sort of, you can link them epidemiologically. And then some of the other states that are surrounding Washington, for example, you could keep drawing this line, and so, well, where did that person come back from the Ukraine to Washington, then Washington to Oregon, then Oregon to California, and so on. And so here's where we are today. This is the latest U.S. map from the CDC. All of the dark states have measles right now in 2019. And thankfully, Minnesota is still light blue. We are holding our breath because our population is not up to 95%. And so we know, as I talked about before, the international travel and things can occur, that it's potential any moment. So this is where we think about the work that happens on a global level. And this is some public health workers in Syria going in the middle of a war with machine guns to try to get polio to the children there. So there are public health heroes that have lost their lives just trying to get that immunization rate up around the world. So if they can do that, we know we can do what we need to do as well. So here's what measles looks like for some of you younger folks in the room who've never seen it. It, as one of my colleagues used to say, a bucket of rash poured over your head. And it starts in the scalp and moves across the face, and it goes over the trunk, and then that's the same way that it clears. And the hard part about measles is that when you see this rash, in the olden days, your grandma could diagnose it like chickenpox. Like everybody, you never went to the doctor, everybody knew what it was. Now, if someone comes into the hospital with a rash like that, they will wait in the lobby, they will be exposing everybody out there because they don't recognize the emergency, the infectious disease emergency that it is. The other trouble with measles is that this rash will emerge and the person is infectious 4 days before this rash onset and 4 days later. So 4 days before this rash, they look like every other American kid in the middle of winter. Runny nose, cough, red eyes, fever, cranky, okay, go to bed, you have a cold. Or go to daycare, I gotta go to work. And so children go to daycare with a cold that then this rash follows, and boom, if that's an under-immunized daycare, you have an outbreak. So measles is really, really tricky that way. The other thing is then to get people who've been exposed, preventive medicine, if we can get to them within 3 days, we can give them measles, mumps, rubella vaccine as a prophylaxis. Or within 6 days, we can give them measles immune globulin. But by the time you get the lab test back, you track down who was sitting in that clinic waiting room or that lobby of the emergency department. You've got a lot of work to do in a very short time. You have to call them in. You have to make sure you're speaking their language. You give them their preventive medicine. If you can get that done, the clock is always ticking in measles exposures. If you can get that done, you can really eliminate more cases who then go out and don't know that they're sick and they're exposing people in airports and malls, and it can be just very quickly exponentially infectious disease numbers because it's so highly contagious. You get it just by airborne spread, breathing, coughing, singing. And it, as I said, lasts in the air for 2 hours. It also lives on surfaces, so if someone's in an emergency room and they cough and you touch where they coughed and you put your finger in your eye, if it's still a live virus, you can spread it that way as well. Moral of the story, don't get sick. Don't go to emergency rooms unless you have to. And if you do, wash your hands and don't touch your face. So these children, 1 in 1,000 of them will die of measles. 1 in 1,000 of them will have encephalitis that will leave them brain damaged, permanently impaired. Some of them are blind, some of them are deaf, some of them will never walk or talk or be themselves. And so that's why we vaccinate. We don't vaccinate because of this rash. We don't vaccinate because of the runny nose and the big pain that it is to track people down. We vaccinate because it's such a highly fatal disease. So let me just walk you through a little bit of a few stories of some populations. So in 1990, the U.S. experienced a great measles outbreak. We had almost 28,000 cases across the U.S. 28,000. There were over 90 deaths. And in Washington State, you had 350 cases and you had 2 deaths. They both were in young adults who were unimmunized. In Minnesota, we had 440 cases. We had 3 deaths, and they were all in young Hmong children. So in the late 80s, early 90s, after the Vietnam War, the Laotian generals could choose wherever they wanted to go in the United States. And going from tropical hill country of Laos, they chose the frozen tundra of Minnesota. I don't know why. No, I do know why. They chose us because we have, like you, a very strong public education system from pre-K to community college to college, and they really wanted their community to take advantage of the education system and said, we'll bundle up like all the rest of these people. So they moved in great numbers to Minnesota. In fact, Sunday, I had the great pleasure of going to one of my friends who's Hmong PhD dissertation celebration party. And so she is exactly, when the general chose Minnesota, she's a graduate of the University of Minnesota in higher education, and just so proud of her. But this community is very unique in that they follow rules. They do what you say. They like, we need to do vaccines today, okay, we're gonna vaccinate. And the Hmong culture, we had to learn a lot. We didn't speak the language. We didn't know what their Western medicine practices were or weren't going to be. And one of the things that rolled out was the 3 children that died, all being Hmong, 2 of them dying in my hospital that I participated in their care. The news rolled it out that Hmong people don't believe in vaccines. And I was just like, no, that is not what we're seeing in the clinic. That's not at all what we're seeing in the clinic. And in fact, when you'd ask a parent for their children's immunization record, they'd pull out their wallet and they'd hand you their kids 6 immunization cards. And I was like, wow, I wish everybody valued these cards the way that they do. And through an interpreter, a dad said to me one time, we needed these cards to get into this country. And if we ever go home, we're gonna need these again. And this great sense of value and personal responsibility to keep track of my own immunizations. And so it was not at all jiving with what I saw. And so we really tried to learn a lot about this culture. And if you have not read this book, I recommend this book to you. It is one of the best things I've ever read. It's from Anne Fatima, and it's called The Spirit Catches You and You Fall Down, which is the English translation for epilepsy, seizures. The spirit catches you and you fall down. And it's about a little girl who has epilepsy, who's Hmong, and it happens to be in the 2nd largest city where Hmong resettled, which is Fresno, California. And each chapter goes between the medical world that she engaged with and then at home in her cultural attempts to try to help heal her epilepsy at home. And this crazy, we are not communicating back and forth chapter after chapter, how everyone was trying so hard. So this is just a wonderful, wonderful read if you haven't read it. A Hmong Child, Her American Doctors, and the Collision of Two Cultures. It's mandatory reading for every new employee at our hospital because the cultural implications of it are really far-reaching beyond the Hmong culture. So I set out in 1992 after having 2 babies by that time, I gathered a group and I said, this is not what the Hmong are, what in my experience, but what do I know? Let's see if we can't prove it. So we did a survey. We went house to house in the local public housing. We talked to a few hundred families, and there was Latinx, there was some African American, there was Caucasian, but mostly Hmong. This is a largely Hmong public housing. We used interpreters, and what we found was they valued immunizations and that they feared disease. So this is the interesting point where we are right now, is that we fear the immunizations more than we fear the disease. That ratio has flipped. And the reason is, when was the last time we saw anybody with polio? We don't have that image in our mind of this is a terrible disease, they're going to close the pool, they're going to stop the Minnesota State Fair, which is like the world coming to the end, because of polio. That hasn't happened in the current practicing physicians and nurses' lives, and it hasn't happened in the parents of young children's lives. And so they fear the immunizations more. But back then, they told me in 1992, we're afraid of these diseases. They believed that the diseases were worse than the pain from vaccines, and that they expected us, their healthcare professionals, to say something when they came in. And so if I broke my thumb, I want you to ask me about my immunizations. Nobody ever asked me. They just fix my thumb and send me on my way. That's American healthcare. So the schedule is complicated, and this was one of the critical things that we found, was this sense of calendar was absent in this group. That they said, well, I thought we were up to date. We went in, we did that when she was 2 months old. Well, it's 2 months, 4 months, 6 months, 12 to 15 month kindergarten. You're never done with immunizations. So we had to drill that home. And so our local civic group, like you, all of you, hosted the Phantom of the Opera at our Ordway Opera House, and they donated all the proceeds to the opening night to the newly born Children's Immunization Project, which I got to lead. And so I took that money and said, okay, we're going to do some outreach in special languages and special communities. So that project still goes today with outreach. So we basically were saying you need 5 visits, 5 before 2, 5 sets of shots before age 2. So we clarified the schedule. We did big community campaign awareness things. We worked on the state immunization registry. I know some of you in this room have dedicated a lot of your lives to that as well. We looked at provider missed opportunities. So making every visit a vaccine visit. Fix their thumb and ask them if they're up to date on their shots. And don't just ask them, because the answer will always be yes. Are you up to date on your shots? Yes. So we say that's a swear word at our hospital. Don't use that phrase. You have to say, when was the last time you had an immunization? And then you get a sense of calendar. And then look at it in your registry, or look at the card if they're carrying that. We developed collaborations with coalitions, and then there was the birth of what's called the Immunization Action Coalition. If you, as a parent, a grandparent, or if you're a health professional, want to know where the easiest way to find immunization information, that's the website, immunize.org. It has become an international recognized source of truth for immunizations, and is still going today. So how did we improve? Well, we improved because we launched the Vaccine for Children program. That was a 1990 Clinton-era program that basically said it doesn't matter if you have an ability to pay or if you have insurance, we will cover immunization. So to that program goes to today. We initiated 2 doses. At the time in 1990, we were realizing that some people who were getting measles had had 1 shot. And because that got them up to 90% coverage, remember I said you have to be at 95%, that second dose covered people who did not respond to the first dose. So really improved our rate. So today you get a dose of MMR at 1 year of age and at kindergarten entry. We really looked at that, the provider role, and then making every visit a vaccine visit, and have worked ever since on cultural sensitivity and not making assumptions, but listening and really asking people in the community, what is the issue here? Help us understand how we can help you, and looking more at cause and effect. So fast forwarding then, we were working away and things were going great until the mid to late 1990s when the Andrew Wakefield, who was a gastroenterologist in England, I'm sure many of you have heard of him, developed this paper. It was a study of, it wasn't even a study really, it was a description of 12 children that was published in the Lancet, making a link between MMR vaccine and autism. So it was later retracted, which never happens, but it was retracted from the Lancet. He lost his medical license in England. He was struck off and then also cited for ethical abnormalities because he was drawing blood at his son's birthday party without permission, and in reviewing of the medical records, there were a number of children who had autism symptoms before the MMR was even given. There was falsification of medical records. I mean, everything about this was not passing the smell test. And so, however, this man and this paper lives to today. He since has moved to Texas, and continues, he believes that MMR and autism are connected. And what he's done is he's gathered a lot of like-minded people and gotten a lot of parents who struggle with an autistic child who really firmly believe that their children's autism is because of vaccines. There have been over 24 studies that have disproven this. I mean, big studies. The last study was over 600,000 people in the study. He had 12 in his study. And 600,000 people in this study, there was absolutely no relationship to the MMR and autism. They looked at high-risk people, that there was already a sibling in the family with autism. They specifically tried to find a connection, and they did not. And so, again, 24 studies should have put this to rest, but the misinformation and some of the I'm going to say it, the Russian bots, it is true that what happened to our election has also happened in the vaccine misinformation. It's basically, and this has been documented, looking at where are the areas where the United States are fighting each other, and let's make that fight even stronger. Let's make that gap even wider. And immunizations is one of them. And so you can read something on Facebook or on wherever your social media platform is that might be written by a Russian influencer. And one will say, oh, vaccines don't cause autism, and the next one says vaccines do cause autism. And so they're not just taking one side or the other, they're continually trying to perpetuate the conflict. And so it's really, really difficult to know how to use social media to combat this. Twitter, Facebook, Instagram, whatever your choice is. These are places where misinformation is being spread. And who is going on there? Parents of young children. So they're reading it. So what I try to do is really make sure that people are going to reputable websites like immunize.org, like the CDC, like the American Academy of Pediatrics. Please do not get medical information off of Facebook. There you go. That's my advice of the day. So as the 90s are going on and into the 2000s, vaccine hesitancy is increasing all around the world. And more and more social media has now met and married vaccine myths. And the fear increases and the fear is growing. And those of us working in the field are saying, we're going to have an outbreak. Measles is going to come back. We are seeing the rates drop. We're seeing people question. We're seeing people not trust us as healthcare providers. And I've been doing this for a very long time. I've been a nurse practitioner since 1987. And you know, we didn't even have computers. I did my thesis on a typewriter. And so when they came in, all of a sudden with the dot matrix printer that had all their questions, it's like, oh, this is new. Okay, we'll answer your questions. And then now they'll come in with their phone and they'll say, so here's the site. And you look at it, it's like, oh my word, why are you looking at that site? But they have a lot of questions. And what's the trouble is we in healthcare don't have a lot of time. These are not quick questions and answers. And so we have to be creative. We have to have a Saturday afternoon chat. We have to do an evening gathering. We have to be willing to put ourselves out there on social media and answer these questions. You have to have a good website at your clinic or your hospital that's steering people towards reputable places. But we're in trouble because of this vaccine hesitancy. We are far from being out of the woods. So we went from this, a long line around the Texas, this is Dallas Public Health Department waiting in line for a polio vaccine. Look at that. To this, where we have Jenny McCarthy and Jim Carrey, and they're on Washington saying we have too many vaccines and it's too dumb. And to that I say, the immune system is amazing. I've studied it my whole adult career, and it is like an ocean. And if you think of measles, mumps, rubella, it's like 3 spits in the ocean. I think the ocean can handle 3 spits. And so your immune system is so vast that it's waiting and it's ready for that vaccine to come in, and that's the antigen to be married up with the antibody that is very specific. It's like lock and key, specific to measles, specific to mumps, specific to rubella. You can't overwhelm the immune system because of the number of vaccines that you're given at the time. Now, they may not like the number of pokes that they're getting at the time, and with their combination vaccines are trying to help that issue. The pain part of it is definitely real. But we've come a long way from waiting in line because we feared the disease more than the vaccines. So now fast forward to Minnesota Measles. This is 2017. We landed on the front page of the New York Times, and this is a family that came in. She's fully immunized, and we had such an outbreak that we couldn't tell who's vaccinated, who's not. Are they here because they're sick? Are they here because they're getting a vaccine? Welcome to Children's, everybody put a mask on, and then we'll figure you out. And so they were well children, that was a well dad, and they were very cooperative and wore their mask. And we had a New York Times reporter that wanted to understand how in the world are we seeing measles in 2017. And we welcomed them in because we felt it was a story that really needed to be told. So again, here's what measles looks like. We call it the fever rash that you saw on the lighter skinned kids, and you see how hard it is to even see it on darker skinned kids. You have to almost run your hand over their back and feel it. And the 3 C's, which is cough, and then conjunctivitis, as you can see in this little guy, and his dad gave me permission to show his face to you because his eyes are really the main part of the story. And then coryza, which is that kind of runny nose, watery eyes, that sort of histamine feeling. They just are absolutely miserable. They are miserable when they come in, and we try to keep them out of the intensive care unit, but sometimes that happens. So what happened in Minnesota? How did we get in this situation? Our Somali families, when they started coming as immigrants and refugees to Minnesota, was very welcoming of them. And we are now the largest Somali community outside of Somalia. Same with the largest Hmong community outside of Laos, largest Liberian community outside of Liberia. Ebola. Back a few years ago, we were worried about that. So they were well immunized when they came. Look at the red line. That is Somali 2-year-olds in 2004 were vaccinated at 92%. Remember, we have to get up to 95%. They were almost there. And everybody else, all the other non-Somali children in Minneapolis, Hennepin County, 2-year-olds were at 88%. And that number hasn't really changed. They're still 88%. We haven't gotten that general population to where it needs to be either. But look at that drop from 92% down to 42%. What happened? Well, remember Andrew Wakefield, the guy who drew blood at the birthday party, who's no longer a doctor? He came to Minnesota in 2008, and you can see the numbers, just the way that it drops. And he had a closed-door meeting with the imams of the Muslim faith and told them that if you need to go back to your mosque and you need to tell your people that MMR will cause autism in their children. and they listened, and they did it. And they listened to their religious leaders. And the rates just dropped, and we could see this. We were predicting it. In 2010, we were down to less than 50%. It kept dropping. And we, in 2017, we're at 42% when our outbreak happened. It was a matter of time. When you have a rate that low, you have international travel, you have disease, it was bound to happen, and we predicted it. And again, this is why we vaccinate. This mom gave me this permission to show this picture too, because people who are anti-vaccine will say, you guys lie about measles. It's not that big of a deal. It's a rash, it's a cough. No, it is a big deal. And this mother was traveling back to Somalia with her family. This child was 9 months old at the time. And she did everything right. She went to the travel medicine clinic, she got her whole family vaccinated, and this little guy had just fallen asleep. And she said, let's just wait on the shots. I don't want to wake him up. And she said, she called it her fateful decision. She went, her child got exposed to measles in Somalia, came back, he was sick, he exposed, they were actually came back to a homeless shelter and exposed a number of people at the homeless shelter who were unvaccinated, because if you don't have a home, MMR vaccine's not the first thing on your list, your to-do list. And she stood at his bedside for 15 days while he was on this ventilator and just prayed that I didn't want to wake him up, and now that's all I do is pray that he'll someday wake up. He did wake up. He did survive. He had terrible measles pneumonia, and this is what we don't know about measles. How is he going to do in his life? How will he do with his lungs later on? And we do know of one story of a girl from the 1990 outbreak who is, she's my daughter's age, 29 years old, and just had a double lung transplant because measles wrecked her lungs at this age to the point that they were not usable anymore after 29 years. So when people say measles is not that big of a deal, they have never stood at the bed of a child in the ICU, and I have, and that's why I feel compelled to share with you. So then the media gets involved, and you can use them and work with them to try to get your message out. And I've stood on the other side of all these cameras many times. And this is the way that people learn. This is the way that parents learn of all cultures, that we do rely sometimes on TV news. And it's if we don't speak up about it, then the anti-vaccine people's message will be out there. So we do allow cameras in, we talk to them and let them talk to whichever parent will be willing to speak up. We actually invited Lena Sun, the health reporter from the Washington Post, in to follow us. She followed me for 5 days and interviewed a family, and it ended up on the Sunday front page, upper half. And that basically it was the worst outbreak in nearly 30 years. And what we were trying to do was expose how this happened. If this happened in Minnesota because of the anti-vaccine influence, it can happen in Washington State. It can happen in California. It can happen in New York. So we were ringing the bell back in 2017. We also learned that you really have to have representative communicators. And so our CEO is very committed to diversity and inclusion and wants our staff to look just like our patients. And so this is one of our Somali advocacy workers, and she and I did a lot of, would give her kind of the clinical, technical messages, and then she would translate it. And we went out together to mosques, we went to homes, we had meetings in the clinics, and really tried to counter the bad message that they had been given in the mosque. We went back and met with a lot of those same imams and said, we have to tell you, you were lied to. Here's the truth about MMR, and it's been a slow turning. And even with the outbreak that impacted our Minnesota children, we are not where we need to be in terms of our vaccination rate. We've done posters in English and Somali and Spanish and are still trying to do outreach to this day of do people see that we are talking to you? Do they see themselves in our literature and in our posters? And then I really was committed to mentoring some of our Somali staff. And this is my friend Simon Nurali and I live on BBC. And the BBC called and said, we really want to talk to you about what does the Somali community think about MMR vaccine? What does the Somali community fear the most? Can we talk to you about that? And I said, well, you can talk to me, but I'm an Irish girl from St. Paul, so I don't think I should answer what the Somali community thinks. That's inappropriate. And so I said, but I have a Somali outreach worker in my team who will talk to you. And she said, Patsy, I have never done media. I go, well, we're doing it tomorrow. And so we had a little practice session, and I said, you can do this, you'll be amazing. And so I gave her a crash course in media relations, what to say, what not to say, how to pivot, all that good stuff. What's your main objective? No matter what they ask you, here's the message you want to get out. You go in with the message you want to deliver. We are holding hands under the table, and she is digging her nails into my hands. And Simon is so articulate and so wonderful. The next day, we got called from the Canadian broadcasting system, and they said, yeah, we want to do a story live on Canadian broadcasting, and we want to talk to Simon Nurali. And I was like, yes, this is great. So she did it alone the next day, and that is what mentorship is. This is not my story. This is our story. And if we don't have the voice from the community that you're trying to reach be the voice, we're missing the mark. And so she has gone on to just do even more great things. So here we are today, people, 2019. This just came out Monday from the CDC. We're at 1,148 cases in 2019. The last highest was that Amish group that I talked about in 2014 with 667. So we had 25 new cases just last week alone. We are not out of the woods. And we're seeing 5 different outbreaks that are going on, and your state included. It's been 30 states. This is the greatest we've seen since the early 90s, and the greatest number since we've declared measles eliminated, which is, as I said earlier, those that are being spread within our own country. So this is hard to see, but this is your state data. On the left in the blue is like that 19 to 35 month old. So this is really measuring how many kids got their first MMR. Remember, you get it at 12 months of age. They even tagged on some extra months to let them get caught up. And this is county by county, and you can see the top is a county. I can't see the name of that county, but it's 50%. So if you have a county that has 50% of their 1-year-olds who should be up to date, you know you're going to have an outbreak. And the highest down below is up to 100%, but most of those are way below the 95% that you need for up to date. The dark line in the middle is Washington State. And what does that number say, 65%? 68%. So the state is 68%, and then you have pockets of communities that are way below that. You have some counties that are way above that. And so, you know, a state number is only a state number. Measles, infectious diseases are very local, so you have to look at local data. So your state is concerned because of how low 68% when you need to be over 95%, and rightly so, which is why this is my 3rd time coming out here to talk to you. And then looking at the kindergarten kiddos on the right, that's in the red, same thing. It doesn't really move too much. It's in the mid-60s where it should be up over 95%. And I think only 2 of them on the bottom are over 90, of your counties are over 95%. So we have work to do here and around the country. So your state outbreak has seen, as of this week, Monday was new numbers, yet another additional case, 85 cases, 70 of them were in children 18 years of age, but they were mostly little kids. They were mostly under 10. Most of them were not immunized, 71 out of the 85, and about a dozen of them, they couldn't find their records, they didn't know. So the majority are unimmunized. One of the latest exposures was at your SeaTac airport. Again, I was thinking about this when I got off the plane yesterday, walking through SeaTac, like, should I put my scarf over my face? Or, you know, that it's just that easy to walk through a crowded airport if someone has measles, and that's what happened here. Clark County has been your primary source, your primary location, with 71 of the 85 cases being just there. And they have 8% of kindergartners who are exempt. Now, 8% doesn't sound like a big number, but again, you have to be at 95% or higher. So most states have 0 or 1% kindergartners who are exempted from vaccines, and your state is 8%. 78% public school vaccine compliance. Again, we need to get that up there. And the matches with the vaccine strain match the Ukraine. So we know that's where they're coming from. So your state's doing great work translating information, as I did in the 90s into Hmong. You're doing it into Russian and doing a lot of very creative outreach. And let's not forget your neighbors to the north. They are not out of the woods here either. They had this was a story about some sons who traveled to Vietnam and developed measles. And this dad's quote was so interesting to me. We're just very cautious parents, and we just tried to do it in the manner that was the least invasive to their health. And so again, fearing that the vaccine was too invasive. And I would say that that ventilator was way more invasive than that shot was. So what we have to do is earn trust and manage fears in the community. And you can see the fear on all of these faces. That little kid is crying with measles from Minnesota. The mom is struggling to understand English and medicalese and when is my child getting better. The provider is trying to understand what those fears are and trying to get her to trust her so that she will be able to vaccinate their child before they go home. It's really quite a psychological and social and cultural dance that we do regularly. So I'm going to close with some of the issues, and that's around exemptions. So exemptions are when you can opt out of vaccines. And this was a map that was put out in 2018, and you can see Washington State. The darker the colors, the greater the concerns are about the counties with high risk for outbreaks because of the number of families that have exempted or opted out, and they base this on school records. So Minnesota is high, Washington's high, Texas is high. We've got these hot spots. And then of the top 15 counties across the U.S., 3 of them were in Washington County. So you can see there Spokane was number 14, and then Seattle, King County, number 3. And so making sure that we're keeping up on vaccinating so we don't allow these exemptions to be the thing that causes the diseases to come back. So this is a map that shows those states that allow medical, non-medical, or religious. So the kind of orangey color is that they have both religious and philosophical exemptions. And I will say there is no major organized religion that opposes vaccines. They all, Jewish faith, Catholic faith, Muslim faith, they have articles written. If you go to that immunize.org and you go to religious statements, they have the actual statements from their religious leaders. There are very, very, very few religions that use opposition to vaccines. And they're not mainstream religions. The blue is that they have religious, their state law will allow religious exemptions, but no philosophical exemptions. And then the green is medical exemptions only. So those are the 3 that I mentioned earlier. And so the good news is, Washington State just last week passed a law that it's a new, and it's just to MMR, measles, mumps, rubella, that you will no longer allow personal or philosophical exemptions. I think you should applaud at this point. So this is going into place in 4 days, July 28th. It is going to be for all daycares and all schools, all levels of school this fall. So there's school nurses that are really grumbling right now because they have a lot of work to do to get those documents up to date and in order. But your state said, we are going to just focus on MMR, and we're going to focus on this personal and philosophical. You still do have a sentence there that allows religious. But as I said, there's very few religious entities that allow that. And your law is very generous and says, we're not going to make the doctor or the nurse figure out what your religion is or prove your religious exemption. If you come with a religious exemption, they will sign it. So there's a little bit of fear that now people's personal philosophical exemptions are going to become religious exemptions. And this is where California had some interesting issues too, but this is a very good move for Washington State. It's going to make a difference. And so will state laws be the answer? I think this has been, in the newspaper in Minnesota and elsewhere. We've seen kindergarten vaccine rates after California passed their law. Look at their rates, went back up over 95%. So they passed a law, Senate Bill 277, a couple years ago after their Disneyland measles outbreak, and it made a substantial difference. Like people who were opting out wanted to go to public school, so they got their kid immunized. And if you don't want to get your kid immunized, you can homeschool, and so that's there is that option. And here's what California did. Look at that before, that on the left, the red is people with 2 or more MMR vaccines, and the green is that they're fully vaccinated. Look at how much of the state was under vaccinated on the left in the red versus after the law went into place. It was just that a couple of little corners there. So the laws do make a difference, but they had to go back to the legislature this last year because they were finding that clinicians were signing medical exemptions that were not real. So, oh yeah, I'll say that you have an immune deficiency or this or that. And thankfully, they have a state legislator, Dr. Richard Pan, who's a pediatrician, and he was like, I'm not having that. So he took another bill back to the California State Senate, and it passed that said you have to have legitimate medical exemptions, and it's going to be proven by the state of California Department of Public Health, not by your clinical person. So they're not messing around in California. So in closing, just to say that we still have these anti-vaccine issues. We've got to kind of make sure that in King County or in St. Paul, Minnesota, that science is under attack and public health is under attack, and trust for healthcare providers is low. We don't have the time, and people don't feel like we're really explaining things that well. We have a lot of work to do on many, many fronts. And so will it take an epidemic? And I think we're kind of on the verge of that right now. So we have to be driven by the why. Why are you here today? Why did I come out here today? Why does this doctor show up every single day to talk to families about immunizations? He knows what to do, what immunizations to give a child this age. They know how to do it. But the why is that we want to see healthy children, healthy communities, healthy states. And so we have to also know that we have a responsibility to others. This is a little guy with leukemia whose mom said, when you protect your child, you protect my child. So it's not just for ourselves, it's for our communities. So putting kids first means that we have to look at cause and effect of vaccine misinformation, look at multi-pronged solutions. We have to be culturally sensitive. There is not one size fits all. You have to really look at the specifics of the community and what the issues are. We have to join together. Public, private, community collaboration really is the key. We have to have data drive us, as you can see those rates and where they come from in the world. Keep measuring, keep adapting, keep doing your interventions. Listen to your community that you're serving, joining together in solutions, making every visit a vaccine visit, that prevention is still our best strategy. It's way better to prevent disease than treat it. There is no medicine for measles. All we can do is give them IV solutions, ventilator support, oxygen, and a lot of positive hopes and prayers to make sure that they survive. Communication mediums that parents use all day, they're on their phones. We better be on their phones. We better get our messages to them. Prepare in advance for that emergency, which is why I was here with your state last year, and then advance your cultural experts specifically at the right time. So what can you do as you leave here today? Hopefully, if you're not all up to date on your immunizations, please go do that. Get vaccinated, speak up, and I know some of you probably have, I'll just say a daughter-in-law maybe that is not really on board with vaccines, and you've got a struggle within your own family. Continue to speak up on behalf of that child. Join together, lean on the science and those websites that are trusted. We have to build back trust in our communities. We've lost trust in government, in public health, in healthcare. And we have to think about the whole world. And so donating, there's lots of great international public health outlets that always need our help. So you can think about them. So I want to just end by saying thank you for all you do for your children, your grandchildren, and this beautiful community. And we have time for questions.
So I'm going to start with asking you a question about, we've all been seeing these children on the border in these awful conditions. And, what's happening there with infectious diseases? I mean, when you're all crammed in there and we have all these people coming in the country legally and illegally, are we working with these at all, or just ignoring it? Yeah,
at the border?
Yeah.
Oh, you're just going to go right there. Okay.
You bet.
Yeah. Okay. All right. So Jane's question is, are we worried about the children at the border? Yes and no. So on the one hand, Mexico and Guatemala, Nicaragua have higher MMR rates than the United States does. So their children have access to vaccines, and many of them have been vaccinated. So the idea that they're bringing in disease here, I think, is a false one. But secondly, because of the closed conditions, and some people have been there for weeks and weeks, if you're due for a vaccine and they're not providing that, we don't have any records, that they're going to outgrow their immunity. They're going to outgrow their coverage. As I said, you need vaccines to be up to date. So I just got called Thursday last week from CNN. They're doing a story on this. Wanting to know, what diseases are down there? What are they seeing? What are we doing about it? And are we worried about other outbreaks? And so tuberculosis, measles, chickenpox, influenza, they've already seen all of them. All of those diseases they've already seen. But other diseases like whooping cough, mumps, and then, childhood things like scabies and lice and things that are not quite as sort of, worrisome, death-like, but are going to spread within that community. So it is a big worry.
Yeah. And the other one is sort of overseas, too. Last Wednesday, it was announced that the Congo's Ebola epidemic is the second deadliest ever. More than 16,000 people have died, and the World Health Organization just declared it a global health emergency. So can we apply the same practices and things you're talking about to this deadly outbreak in a third world country?
Yes, yeah, thank you, Jane. I think that's a good question. So Ebola is not as infectious as measles. Measles is the most infectious disease there is. So that's one thing, is that the way that Ebola is spread, you do have to have, contact with blood, and it requires a fair amount of direct contact with someone who's ill at the time. It is in a terrible situation in the Democratic Republic of Congo. Has been looked at 4 times, should we declare a world public health emergency, and last week, the 4th look, they said yes. And the reason was because it is now spreading into larger cities. In the past, it was contained mostly in villages and places that are not going to have as much international travel. So because of the location of potential international travel, and you'll remember several years ago, the individual in Texas who had Ebola, that we spent millions of dollars in the United States because of that one story. And I know our hospital just spent tons and tons of time preparing, and we did actually have a rule-out case who ended up having adenovirus, but he just had gotten off the plane from Liberia, had all the symptoms of Ebola, and there we were in our suits and, taking care of the patient, and we were glad that we practiced. So I think it is a concern. The good news on Ebola is there is now, since that last story, there now are some very effective, more than one effective vaccines that are being given. But in some of these communities, again, they don't trust public health, so they're not letting them in. So even like Doctors Without Borders are being turned away, and they are brave people. So some of the public health infrastructure is so deteriorated that we can't get something that works well, the Ebola vaccine, to them. So it is lots of the same principles.
So we have someone back here who has a question, and
I'll repeat it if you want to.
and then there's someone over here next.
Can Andrew Wakefield and people like him, including Facebook, be prosecuted for basically spreading disease through misinformation on purpose?
Yeah, well, no, I said yeah, that's not the answer. Yeah is I hear and understand your question, and believe me, I have laid awake at night thinking about this. And I think if there was ever a story that would be able to be upheld in court, cause and effect, it's the Minnesota story. And that's part of why we invited Lena Sun in to help us document words matter. Truth matters, science matters, and for him to come in and to tell leaders of a community false information and then have them act on it, we see the consequence. It's a direct consequence. There are some people who, there's a paper written by Dorit Reiss, R-E-I-S-S. If you're interested in this topic, she wrote she's a law professor in California. I don't remember what school, Dorit, D-O-R-I-T, Reiss, R-E-I-S-S, and she believes that it would be difficult but possible, and that you would have to have a pretty clear case like Minnesota. Maybe I'll do that in my retirement, go sit in a courthouse someday, I don't know. But someone would have to take him to court. There are others who have said this is a global crimes against humanity because the story is so long, we don't have time, but it really started, the spread of measles started in Europe. So in England and Ireland, 6 children died in Ireland after his report came out of measles because they stopped vaccinating. So you can see the impact in the wake of his Wakefield work. And so crimes against humanity has been raised by some groups, but we'll see. Okay, Jane, should I just call him? Yeah, sir?
Over here.
Oh, sir.
What do you think is the best reply to a candidate for political office who says that he doesn't support legislation or action to make vaccination compulsory because he believes in freedom of choice and freedom of speech, and that parents have the right to decide what's best for their children?
You guys are really making me work here today. So that is a great question, and it is the new theme of the anti-vaccine movement. First it was MMR causes autism, then it was thimerosal, mercury in vaccines, then it was too many, too soon altogether, and with each of these steps we have answered with science. And now the approach is my child, my choice. You saw one of those posters. Personal freedom. And this has been challenged in court a number of times, and the level of public health necessity rises above individual freedoms. And so the analogies that I like to give to parents, and I could say this to a candidate as well, is I like to drive fast. I don't like to stop at stoplights. I want to get where I'm going. But if I do that because I am me and I get my choice, I could harm myself, I could harm other people. And so we have laws, stoplights, seat belts, no drinking and driving, no indoor cigarette smoking. We have laws that individual freedoms are infringed upon, but it's for the good of the whole. And so public health and vaccine preventable diseases really rely on that principle that we have to protect one and we have to do it for the good of the whole. That sounded a little like, so I'm going to go over here. You guys were, there's three. Oh, okay, you're in charge. Sorry, I'll follow you. I'll be quiet. Go ahead.
First of all, thank you very much for sharing the results
Sorry,
of
left
your work.
table. Sorry, I tried.
My question
Yes.
is it true that people who are born before a certain date need not be vaccinated because it can be assumed that they were exposed to it in their childhood? And I'd like to reassure everybody here that despite my question, I have been vaccinated. Thank you.
For measles, that is true, and the year is 1957, that it was ubiquitous, like everybody got measles. And so 1957 or earlier, that you are assumed immune. Yes, that you can have a milder course that your mom didn't record or whatever. Yes.
So one of the things that's made autism so easy to target has been that, you know, there's no known cause for it. But there is a bit of good news, which you may not be aware of. In June of Scientific Reports, there was a report published from a team down at Arizona State University looking at the gut biome. Are you familiar with that?
Mm-hmm, a little bit. Go ahead.
Yeah, okay. But just basically for the rest of you, it showed a direct correlation between the gut biome and causing autism and being able to correct the gut biome and curing, or at least dramatically improving the symptoms of autism. There was a bit more to the study, but at any rate, I think it's the first direct evidence we have about the cause of that and may be useful in overcoming some of these myths.
I really agree with your opening sentence of one of the reasons that MMR causes autism has stayed on as such a long-lasting myth is because we do have a lot of autism. We see a lot of autism. We're getting better at diagnosing autism, which is part of why the incidence has gone up. But you want an answer. And if the answer is not entirely clear, you look for other places. And because the signs of autism and measles, mumps, rubella are given at about the same time, at 12 months of age, people associate that event, the MMR vaccine. But temporal association is not the same as causal association. And however, I would say since the 90s, the number one thing that we know about autism is that it's highly genetic in origin, that there's a genetic basis to it, and there's more and more studies that are coming out supporting that.
So we have one over here and one more over there.
Hi, my name is Lynn, and I'm from the Whatcom County Health Department, and there's a whole group of us here. And I just want to assure everyone that we are working very hard, can certainly use your help, but are working very hard to get that immunization rate up from the 67 percentile. We are running immunization clinics. Our next one is in Blaine from 4 to 7 on August 21st. We have a couple of contests going on right now. One is for grades 2 through 5, and it is a coloring contest, My Vaccine Activity Book, which was actually produced by Children's Hospital of Philadelphia. And then an essay contest for grades 6 through 12 about Maurice Hillman, who actually is the kind of counter attack on Mr. Wakeman there. He invented over 40 vaccines. And that contest has some wonderful prizes, including laptop packages. So we are working hard, and whatever you can do to spread the word, we would much appreciate.
I think our public health heroes deserve a round of applause here. Thank you. You have a very, very hard job now, I think more than ever. So thank you guys so much for all you do.
Last question.
Yes, I want to ask a question about immunity itself, especially for our age demographic here. Is there any evidence that immunity wears off after a number of years, and should we get revaccinated? And also, is it possible for those of us who have immunity to be carriers?
So that's a great question. The answer is very disease specific. So we'll stick with measles because the answer does vary according to what the disease is. So with measles, the CDC recommends that everyone, all adults, have either proof of immunity that you had it, you remember that you had it, you have a document that you had it, or that you've had 2 doses of MMR properly spaced apart. There is not a recommendation at this point to give a 3rd MMR for measles, because if you get 2, you're way up in that high 90% coverage, and it does maintain lifelong immunity. Mumps, on the other hand, is not that great. It's only about an 80% coverage. So when there are pockets of mumps outbreak, they will bring in public health to do a 3rd dose of MMR in a mumps outbreak. There are some adults who definitely have to have the 2 doses of MMR to, for example, work in healthcare. So if you're in healthcare, you have to either show your 2 dates or a titer for measles because of how important it is to make sure that we have immunity. So I can stay. I'm not going anywhere. I'm not going to Minnesota till tomorrow. So if people have questions, I'm happy to stay up here and answer those. But thank you so much for being here today.